Alright, so we're just putting up a pharyngect infusion, which is a very quick way to basically restore iron levels. And this particular patient, who doesn't want her face shown, just an arm, has an iron deficiency because she has heavy periods. So this is the infusion here, and it's probably going to run over about 15-20 minutes, and it's a very safe way to deliver or replenish iron stores quite rapidly. So traditionally we use oral supplementation, which is fine, but there is a lot of women that don't like to orally supplement because either they have a side effect from the iron, like constipation or black stools, or it takes a little bit too long. So the quick fix, or the hack, is just to go with an iron infusion. And these are being successfully used all over the country and generally used by GPs. And I think if a GP can put one of these up quite quickly, it really helps a patient out to know that in 48 hours their iron stores are going to be up, and they're going to get a whole lot more energy quickly. So there's a lot of patients that will be extremely happy to have one of these.